Good day everyone, I'm Precious Rodriguez from BSN 3D and today I'm going to perform the procedure code COC7 or providing tracheostomy care for the patient. The goal of this procedure is for the patient exhibits a tracheostomy tube and side free from drainage, secretions, and skin irritation or breakdown. For the equipment that is needed, check for the following. For the implementation, bring necessary equipment to the bedside standard or bed table. Perform hand hygiene and put on PPE if indicated. Identify the patient. Close curtains around bed and close the door to the room if possible. Determine the need for tracheostomy care. Explain what are you going to do and the reason for the patient even if the patient does not appear to be alert. Adjust bed to comfortable working position, usually elbow height of the caregiver. Lower side rail closest to you. If the patient is cautious, place him or her in a semi-polar position. Check for the lung sounds. Place the towel below the trachea site, covering the neck and the chest of the client. Put on face shield or goggles and mask. Sanction tracheostomy if necessary. If tracheostomy has just been sanctioned, remove solid dressing and discard before removal of gloves used to perform sanctioning. Prepare the basins and cleansing solutions. Mix sterile water and plain NSS and water in one basin. Be sure it will fill 0.5 inch of the basin. Add another plain NSS in another basin that will fill at least half inch. Then perform gloving. Remove the oxygen source if one present. Stabilize the outer cannula and faceplate of the tracheostomy with your non-dominant hand. Grasp the locking mechanism of the inner cannula with your dominant hand. Press the tabs and release the lock. Gently remove inner cannula and place in first basin with plain NSS plus water. Let it submerge 3 for few minutes. Simultaneously, gently slide the tracheopad dressing downward and discard. Check for some exudates or drainage, skin breakdown, and irritation inflammation. Clean the inner cannula of the trachea tube using the prepared plain SS plus water and use brush to remove solidified or sticky mucus. Rinse using the second basin with plain NSS only. Discard gloves and put on another gloves if necessary. Dry the inner cannula using sterile gauze pad. Gently reinsert it back to the tracheostomy tube. Be sure it is properly locked. Dip cotton tip applicator or gauze sponge in a cup or basin with sterile saline and clean stoma under paid. Use each applicator sponge only once, moving from stoma site outward. Pat skin gently with dry 4x4 gauze sponge. Slide commercially prepared tracheostomy dressing or pre-folded non-cotton filled 4x4 inch dressing under the paste plate. Check the fit of the tracheostomy collar. You should be able to fit one finger between the neck and the collar. Check to make sure that the patient can flex neck comfortably. Apply oxygen source if necessary. Remove gloves. Assist patient to a comfortable position. Raise the bed rail and place the bed in the lowest position. Remove additional PPE if used. Perform hand hygiene and documentation. Reassess patient's respiratory status, including respiratory rate, effort, oxygen saturation, and lung sounds.